Hello everyone, I'm Shweta, doing second MSc Microbiology. We are going to discuss about diseases caused by lactic acid bacteria. Firstly, what is lactic acid bacteria? The lactic acid bacteria are generally considered as beneficial microorganisms widely recognized for their roles in food fermentation, probiotics, and gut health. They produce lactic acid as their primary metabolic byproduct, and many strains are used in the production of yogurt, cheese, fermented vegetables, and other foods. However, while lactic acid bacteria are generally harmless or beneficial, there are certain circumstances where they can cause infections or diseases, particularly in immunocompromised individuals or when they are able to overgrow due to certain conditions. The first disease is lactobacillus infections. Lactobacillus species are among the most commonly studied LAB are often used as probiotics. While these bacteria are usually benign or beneficial, they can occasionally cause infections, especially in immunocompromised patients. The first, it causes lactobacillus bacteremia. This is a condition where lactobacillus enters the bloodstream and leads to sepsis. It has been reported in patients with underlying conditions such as cancer, diabetics, or those undergoing invasive procedures, such as the examples include central venous catheter placement. The second one is endocarditis. Lactobacillus species have been associated with rare cases of infective endocarditis, which is an infection of the heart valves, usually in individuals with heart conditions or artificial heart valves. The third, it also causes lactobacillus associated infections in the gut. In immunocompromised individuals, the lactobacillus species can cause peritonitis, which is an infection of the abdominal cavity, or other infections following gut flora imbalances. The second, it causes enterococcus infections. The enterococcus species, although not strictly lactic acid bacteria in the classic sense, are part of the lactic acid producing group and often inhabit the intestines. Some strains of Enterococcus are opportunistic pathogens and can cause serious infections in certain settings. The first, the enterococcal bacteremia. Enterococcus species, especially Enterococcus faecalis and Enterococcus faecium, can cause blood infections, particularly in hospitalized patients. These infections are more likely in individuals with weakened immune systems, such as those undergoing surgery or cancer treatment. The second, it causes urinary tract infections. The Enterococcus species are a known cause of urinary tract infections, especially in individuals with long-term catheterization or those with underlying urinary tract abnormalities. Endocarditis. Enterococcus species can infect heart valves, leading to infective endocarditis, particularly in patients with prosthetic valves or other predisposing heart conditions. The next, it also causes wound infections. In rare cases, enterococcus can cause infections in wound or post-surgical sites, especially in immunocompromised individuals. The next disease, it causes bifidobacterium infections. Bifidobacterium is another type of lactic acid bacteria often used as a probiotic. Infections involving bifidobacterium are rare but can occur particularly in immunocompromised patients or those with a disrupted microbiome. First, the Bifidobacterium bacteremia. In immunocompromised individuals, such as those with cancer, HIV, or those undergoing invasive treatments, the Bifidobacterium species may enter the bloodstream and cause bacteremia, leading to fever, chills, and systemic infections. The next, peritonitis. In rare instances, bifidobacterium can cause peritonitis, especially after abdominal surgery or in people with gastrointestinal tract abnormalities. The fourth one is Streptococcus infections, which is group D streptococci. While most Streptococcus species are not classified as lactic acid bacteria in the strictest sense, some strains of Streptococcus, including Streptococcus bovis or Streptococcus equinus, produce lactic acid and are considered part of the lactic acid bacteria family. These bacteria are typically harmless but can cause infection in specific circumstances. The Streptococcus bovis endocarditis. Streptococcus bovis, which is found in the gastrointestinal tract, which has been linked to endocarditis and is associated with colon cancer or other gastrointestinal disorders. The bacteremia and sepsis. Streptococcus bovis and Streptococcus equinus can cause bacteremia and sepsis, particularly in individuals with gastrointestinal cancer or underlying gastrointestinal diseases. The fifth disease it causes Lactococcus infections. Lactococcus species such as Lactococcus lactis are used in dairy fermentation and are generally considered as safe. However, infections are occasionally occur in very vulnerable populations, especially those with compromised immune systems. Lactococcus bacteremia. Though rare, Lactococcus can cause bacteremia, particularly in individuals with central venous catheters or those undergoing invasive medical treatments. The second, endocarditis. In extremely rare cases, Lactococcus species may contribute to endocarditis, although it is not a common cause. And finally, it causes infections related to probiotic overuse. While probiotics, often containing lactic acid bacteria, are usually safe for most healthy individuals, the overuse or improper use of probiotic supplements can cause complications, especially in certain vulnerable populations. The first, it causes gastrointestinal issues. In some cases, taking large amounts of probiotics can lead to bloating, gas, or mild gastrointestinal discomfort. Invasive infections. In rare cases, especially with immunocompromised individuals, overuse or misuse of probiotic supplements has been associated with systemic infections caused by the overgrowth of lactic acid bacteria species such as Lactobacillus and Enterococcus. Risk factors of lactic acid bacteria infections are more likely to occur under specific circumstances. The first, immunocompromised individuals, people with weakened immune systems due to conditions like HIV, cancer, or diabetics, or those receiving immunosuppressive treatments are at higher risk. The second, invasive medical procedures. The use of devices such as central venous catheters, pacemakers, or prosthetic heart valves can provide a entry point of lactic acid bacteria species into the bloodstream. The third, gastrointestinal surgery or diseases. Conditions that disrupt the normal gut flora such as surgery, inflammatory bowel disease or gut perforations that increase the lactic acid bacteria infections. Thank you for your patience.